So we'll just take about 10 minutes to see how we apply that frame, and then you get to jump in and do it. It's interesting because our fellows come to our fellowship and they want to do frames, they want to do circular external fixators. And all we want to do as surgeons is to venture away from external fixation. But sometimes it's a wonderful tool. So it's just one more tool in our armamentarium. And Blount disease, I think, is a very common clinical scenario in which I will still use a circular hexapod, especially when there's joint instability. So let's just take 5 minutes to review how you're going to build that frame and the basics of circular external fixation, and then we'll jump in. So, in a nutshell, the first thing you want to do when treating a Blount patient is address the elephant in the room, the figurative elephant in the room. It's the soft tissues. Some of these patients are extremely, extremely big, and you have to know what's your biggest ring available. Some of these rings go up to, 300, 230, 260, over that. So keep that in mind when treating these patients. You might need to use unusually large, less stable rings. There's rings of every sizes, but we will use a 5/8 or 2/3 ring around the knee, open in the back, and we will use a full ring around the shaft, just for more stability. For this specific frame design, we want to have the A-tab facing towards the front. And the ring also tells you which side to put distally and which side to put proximally. And the truth is, even if you don't respect it, that's okay, it will work, but it will make your job as inputting all the parameters in the software much more difficult. The strut connections are always the same. It's always 1 through 6, and by convention, strut number 1 will be front, and if you're looking at bird's eye view, it's going to be front right. If you're looking from a surgeon's perspective, it's going to be front left. And then it goes, once again, from bird's eye view counterclockwise, 2, 3, 4, 5, and 6. However, if you're surgeon's view, it's going to be clockwise. Just keep that in mind. Well, yes, with this system you have some leeway, right? But half of them are going to do it with Hortex, the other half will do it with TSF. However, with this specific system, sky's the limit. You can put the struts anywhere you want. You just have to tell the software you can do that you're doing that. There's struts of different sizes. There's actually 3 sizes. There's short, medium, and large. And this specific system has both an acute scale, which is an A scale. Sorry, a gradual scale, which is the A scale, and an acute scale, which is the B scale. The benefit of that is that you can do adjustments rather than strut changes. So you need less struts in your armamentarium. You read the A scale by looking at that little dial with the line, but you'll read the B scale by looking at the main locking bolt. The B scale goes in increments of 2, and the A scale goes in increments of 1. And the actual length of the strut is A plus B. This system also has decimals. You have the option to do it with decimals, so point by quarter turn increments, or you can tell the system to ignore the quarter turns and do full numbers only. The cubes are just regular cubes. They go from 1 through 5. The difference is that this system has double cubes for added stability. So let's go straight into how we build this frame. There's 2 ways to build the frames. You can start by using a reference wire, which is what I'm showing here, or you can start by using just half pins. So what I would recommend you do is you start by placing a wire transverse from lateral to medial, anterior to the fibular head, parallel to the joint line. That will suspend your ring in the coronal plane. Your second step is to drop a 3-hole cube in the front of the ring, dial in the amount of slope that you desire. In this case, it's give or take 10 degrees, and lock that sagittal plane with a half pin or shank screw. Once you have 2 points of fixation in that proximal ring, it's stable enough, what you do is you ignore the rest of that ring and you go straight to the distal ring. I like to suspend the distal ring using either a 4 or a 5 hole cube, and I put the first pin directly anterior. Why directly anterior? Because I know it's never going to be in the way of any strut. It's always going to be in that triangle where no strut goes. So that first pin locks the distal ring in the sagittal plane. So you put it perpendicular to the mechanical axis, and you will put a second pin in a different axis to lock that position in the coronal plane. So now you have 2 points of fixation in the proximal ring, 2 points of fixation in the distal ring. What you can do is place all the six axis struts, and then you know exactly where your next pins can go without impinging on any of the struts. So 2 points of fixation, 2 points of fixation, 6 axis struts, and then you can add a third point of fixation proximally and distally. What we like to do is add actually 2 points of fixation additionally in the proximal ring by doing a 1 hole cube in Gerdy's tubercle, a 2 hole cube in the medial face, and then we pull out the wire because wires are not super well tolerated by patients. I recommend using mechanical advantage when building that frame. So knowing that most of your correction will be in the coronal plane for Blount with a little bit of correction in the sagittal plane, make sure that you have at least 2 good pins in that distal fragment that will steer the distal fragment medial to lateral or anteromedial to posterolateral, so that you have the maximal strength to really steer the ring, the segment. So this is this patient. That was actually the first case I used Orthex for. I did it with Dr. Herzenberg. That was, I believe, 2018. And this is after correction. So it's a very nice frame. If you don't have access to Elizarov wires for any reason, so what you can do is use 2 half pins to mount your proximal ring, in which case your first pin should be in the sagittal plane using a 3 hole cube, right distal to the tibial tubercle, distal to the patellar tendon, and the second pin will be from medial to lateral with a 2 hole cube. Here they show a 1 hole cube, but I'd rather if you did it with a 2 hole cube. And then third will be in Gerdy's tubercle with a 1 hole cube. Are there any questions so far? All right, so that will be it for now. Let's go to the workstation. You can try either mounting with a reference wire or mounting with 2 half pins. 2 points of fixation proximal, 2 points of fixation distal, 6 axis struts, then complete your points of fixation proximal and distal. Yalla.